week on Medical Rounds, we're going to talk about a VP shunt malfunction. So a VP shunt is a ventricular peritoneal shunt in which a small tube goes down into the brain, into the ventricle, and drains all the way down into the peritoneum, which is in your belly. And so this patient had a history of a subarachnoid hemorrhage, in which is a brain bleed. It affected her spinal fluid, the way it flows, and the way it's absorbed. It was causing her to have hydrocephalus. It's a common condition that we see in infants. However, we see it in the elderly very commonly as well. And then in this situation, she too had it. You put a shunt down into the ventricle and then drain that spinal fluid down into the belly to help with the flow of spinal fluid. Her VP shunt had been in for several years, and she was having symptoms of falling, confusion, and incontinence of her bladder. We ordered some tests as well as a shuntogram. We were able to see that there was a blockage. She is going to follow up with a neurosurgeon and have this addressed. So that was an interesting case this week. Hanna, SkinMed Solution, Medical Rounds.